When you're dining out in a restaurant or shopping in a supermarket, chances are you'll see a selection of food marked with a gluten-free stamp. A gluten-free diet has become one of the most popular trends in the past few years. And while many adopt it as a means of losing weight and improving their health, there are actually medical conditions characterized by an intolerance to gluten. On the program today, we'll talk more about these medical conditions and the pros and cons of a gluten-free diet when it becomes a lifestyle choice. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk on CNN Philippines. Today, gluten intolerance is a fairly common concern. It means having an adverse reaction to gluten, a protein found in wheat, barley, as well as rye. And there are a number of potential reasons for it, like celiac disease, non-celiac gluten sensitivity, as well as wheat allergy. Now, our guests are here today to tell us more about these conditions. With us is Dr. Dennis Ngo. He's a gastroenterologist and the secretary of the Philippine Society of Gastroenterology and a consultant at the UST Hospital. Also with us is Ms. Emilita Ong Lavilla. She's a registered nutritionist, dietitian, and dietary department chief at the Philippine General Hospital. Now, gluten-free foods have become increasingly popular, with many limiting their consumption of gluten or banning it from their diets altogether. Now, umpisa ako kay Miss Emmy. Miss Emmy, ano ba talaga itong gluten? Saan ba ito nakikita sa pagkain na karaniwan kinakain ng mga Pilipino?
Okay, so yung gluten po ay protein na napapalabas siya pagka minasa ng minasa ang wheat flour at saka ang tubig. So karaniwan siyang nakikita sa wheat, pati sa rye at saka dun sa barley. So, pagka sa mga common na pagkain, makikita natin siya dun sa mga tinapay, sa mga cereals, sa baked goods, yung mga cakes, pastries, yung mga crackers, pasta.
Okay, so bread, soy sauce, cakes, as well as pies are some of the culprits of a gluten-free diet. For some, though, this is a lifestyle choice, but for others, cutting out gluten is somewhat necessary. And there are many that experience digestive or even health problems when they eat certain foods that contain gluten. And this is called a food intolerance. Dr. Dennis naman, what's the difference between having a food intolerance and having a food allergy?
When we speak of food allergy, you have an adverse reaction to the substance or product found in the food that you're ingesting. And then, under that heading, meron tayong toxic and non-toxic. Dahil pag sinabi mong meron kang food intolerance, meron kang concept na hindi ito immune-mediated. Yung intolerance, hindi ka pwedeng mag-take dahil hindi kaya ng katawan. At local effect, ibig sabihin, maaaring magdumi ka, maaaring magsuka ka. Kaso pag food allergy, mukhang systemic, ibig sabihin lahat ng parte ng katawan pwedeng involved.
Now, while a food allergy causes an immune system reaction, food intolerance is usually less serious and limited to a digestive problem. Now, it's very common. I'm sure you've experienced an unpleasant reaction to something you've eaten at one point, and there may be some warning signs that can point to it. Dr. Dennis, explain to our viewers kung anong mga simptomas na pwedeng maramdaman ng isang tao kapag meron silang nakain at meron silang food intolerance towards this?
Kadalasan, yung pakiramdam mo parang nasusuka ka, parang naduduwal ka, and pag tinuloy mo na yung pagkain na ingest mo na, maaaring sasakitan tiyan mo or magkakaroon ka ng episodes of diarrhea, multiple episodes of diarrhea. Ibig sabihin, pag kumain ka ng produktong naglalaman ng gatas at meron kang lactase deficiency, ito ay magkakaroon ng effect sa katawan mo. Yun na nga, yung pagtatae.
Miss Emmy, paano naman yung mga taong nagsasabi ayaw nila ng malalansang pagkain, ayaw nilang kumain ng mga chicken? Pwede ba itong food intolerance?
Ang common naman na sinasabi pagdating dyan ay allergic sa chicken kasi nagkakaroon ng pangangati, pamamantal. Yung iba, nahihirapang huminga pagka kumain ng manok o kaya ng seafood.
Dr. Dennis, many people might think na kapag meron silang simptomas sa gano'n, like what you mentioned, for example, lactose intolerance, na ang gagawin nila or iisipin nila na if they keep on taking this product, maybe masasanay din ang katawan nila, hindi na nila mararamdaman ng simptomas na to pag ulit-ulitin nilang i-take. What would you advise for those who might think that this is beneficial?
So ang ibig sabihin, Dr. Gomez, parang magiging sanay ng katawan para mag-a-adapt na. No? Pwedeng mangyari yon, pero hindi dapat yan gawin on their own. It should be guided. However, we have to really identify saan nanggagaling yun intolerance at anong particular product. Dahil may mga, sabihin natin, poultry or manok. Yung ibang tao, allergy sa yung dressed chicken sa supermarket. Pero sa native, hindi sila nag-allergy. So, hindi sa manok ang intolerance. Ang problema ay nasa feed ng manok. So, mahirap i-conclude na pag tuloy-tuloy mong gamitin yan, ay magkakaroon ka ng mag-a-adapt ang katawan. Personally, hindi ko i-recommend sa ating mga pasyente.
There are other medical conditions that are characterized by a gluten intolerance, such as wheat allergy. We'll discuss them after we return. And later on, we give you the pros and cons of skipping gluten by choice. Keep it here on Med Talk Health Talk. You're watching CNN Philippines. I'm Dr. Freddy Gomez, and welcome back to Med Talk Health Talk. Today, we're talking about a gluten-free diet. And there are some conditions that require people to eliminate gluten from their diet completely. Now, common in children and infants, wheat allergy is a medical condition often confused with maybe celiac disease. And it happens when the immune system mistakes gluten or another protein found in wheat as a disease, prompting a response that can lead to congestion, difficulty breathing, and much more. Dr. Dennis, are there other symptoms that our viewers need to watch out for when it comes to this type of condition?
Because the condition of allergy or gluten sensitivity or wheat allergy comes with different manifestations. You can come with a gastrointestinal manifestation, but you can also come with dermatologic manifestation. So marami siyang pwedeng ipakita. Hindi lahat pagdudumi lamang, hindi lahat dahil sa wheat. Like some patients will manifest with bone disease, osteopenia, and others. Bloated sensation, pwede po yun. So, mahirap itukoy kung ano ang isang particular na complaint na maaaring maranasan ng isang pasyente meron wheat allergy.
Miss Emelita, a question for you is, ano-ano ang mga triggers ng wheat allergy? Karaniwan lang ba ang wheat nasa tinapay lamang?
Sa tinapay, pati yung ibang ingredients, ginagamit ng wheat na ingredients ng ibang produkto, kagaya nga ng toyo, tsaka ng ice cream, tsaka yung hotdog, meron din yung iba. So, importante na nagbabasa ng label. And then, ang triggers na sinasabi for wheat allergy, kung kumain ka ng mga pagkain na may sangkap na wheat, o yung iba, yung pagsinghot pa lang ng mismong wheat flour, nagkakos ito ng allergy sa kanila. So, common siyang nagmamanifest among the bakers.
Now, Dr. Dennis, one of the topics that are being talked about when it comes to gluten allergies, when it comes to food intolerance, are these micro-inflammations that may happen to the body that may not be noticed by the person initially. The symptoms may be very faint, very mild, but may have detrimental effects sa katawan in the long run. Could you talk a little bit more about this?
If you are going of celiac disease per se, ito ay may chronic effect sa digestive system nga. Magiging atrophied ang small intestinal villi, and in the future, dahan-dahan ito parang isang carpet na mayat-mayat dinadaanan ng paa, magiging flattened yan. Ano ba ang basic purpose ng small intestine? Para mag-absorb ng vitamins, nutrients, and water. What will happen now if you remove all the vilus or the villi of the intestine? There is no more surface area for absorption. So, hindi natutupad ng small intestine ang trabaho niya. Ang effect, malnutrition, malabsorption, and the total effect of the body is going to be detrimental, very weak, magkakaroon ng vitamin insufficiency, magkakaroon ng certain disease entities dahil sa epekto sa absorptive area ng small intestine.
Now, Dr. Dennis, pagdating naman sa treatment, if someone finds out that they have hindi magandang reaksyon ng katawan nila with gluten products, with wheat products, how is this treated? Is there further treatment needed? Medications, perhaps?
As far as treatment is concerned, if we have indeed established this is celiac disease, then the only treatment is absolute abstinence from a gluten-containing diet. But we have to be very sure that this is indeed celiac disease because you have to establish the diagnosis by the gold standard, which is the biopsy of the small intestinal mucosa.
Now, Miss Emmy, ang tanong ko is a lot of the supermarkets now na merong gluten-free packages. Kung mapapansin ng may iba, nagpa-fluctuate din ang presyo. Minsan pwedeng mas mahal. In general, is it worth it for people to spend a little more for something that is gluten-free?
From the standpoint of a nutritionist dietitian po, hindi po kailangan. So why spend more kung hindi naman kailangan talaga? I mean, kagaya nung diniscuss ni Dr. Dennis, kung talagang confirmed na celiac case yung pasyente, ito yung instances na kailangan ng gluten-free diet. But all other concerns, hindi naman po kailangan gumasta ng mas malaki for any reason na gusto lang. Kasi sa amin pong practice, kailangan lang naman ang gluten-free diet dun sa merong celiac disorder or merong intolerance.
Okay.
Other than that, wala pong indication.
So, ang masustansyang well-rounded meal pa rin ang pinaka-importante. Now, eliminating gluten by choice, our experts weigh in after a short break. We want to be your partner for a lifetime of good health. Stay with us on CNN Philippines. Welcome back to Med Talk Health Talk. I'm Dr. Freddy Gomez. People with medical conditions characterized by a gluten intolerance have no choice but to eliminate gluten from their diet. But in the past few years, many have claimed giving up gluten can lead to weight loss and even improved health as well, prompting others to adopt a gluten-free diet. We'll discuss the pros and cons. I'll start first itong discussion kay Miss Emmy. Is there really a connection between isang diet na gluten-free at ang pagkabawas ng timbang ng isang tao?
Hindi ko po makita yung connection because ang weight loss ay related siya sa yung balance ng calorie intake at saka yung calorie output. So yung total na pagkain versus yung mga expenditure na nagagamit ng katawan sa pagtatrabaho at basically for the physical activities. Yung iba kasing tao, nakakakain sila ng bread na kunyari isang loaf ng bread at one sitting, so biglang nag-gluten-free diet, tinigilan yung pagkain ng isang loaf ng bread na yon. Significant po yung caloric reduction nun sa kanilang daily intake.
Now, while eliminating gluten doesn't necessarily result in weight loss, being gluten-free can lead to healthier food choices. But if you're determined to go gluten-free, we just want to remind you that it can set you up for some nutritional deficiencies. Dr. Dennis, can you explain this to us? Eliminating a food group, for that matter, say wheat, how would this affect our nutrition absorption or our overall health in general?
Almost every food product that we have, especially as Asians, with rice as our major component in our diet, and we have bread. If we eliminate gluten-containing food products, you are going to come with a very limited choice and supply for nutrition. Therefore, it will affect basically your intake, and it will affect also the supply of certain nutrients. Why not focus on the carbohydrate family in general?
Now, Miss Emmy, review natin ulit para sa ating mga viewers. What foods, sama na rin natin kung mayroong mga drinks that need to be avoided if going gluten-free?
For the drinks, yung mga malt drinks po, kasama dito yung beer at saka yung mga chocolate products, mga tinapay, at saka yung barley. So, uso ngayon yung mga barley drinks, di ba po? So, these are drinks that contain gluten. Pagka kailangan nyo i-avoid yung gluten, so tandaan nyo lang po, wheat, rye, at saka yung barley and malt.
Okay, now Dr. Dennis, how about reminding our viewers what should they be eating for a really healthy and robust gastrointestinal system?
Since we are in the Philippines, meron tayong sa nutritional component namin, tinuturo namin yung pinggan Pinoy. Ibig sabihin yung plato natin, i-divide natin sa 4. Meron tayong carbohydrate groups in one set, which is yung kanin natin or tinapay or pansit or pasta. Hindi ito sinasabay-sabay. Ibig sabihin, isa lamang sa pamilyang to ang pipiliin mo. At sa kabila naman, 1/4 mo, meron kang component na tinatawag na proteins. Maaring isda, baka, manok, or iba pa. Hindi lahat dapat nandun. At syempre, meron tayong fiber at ito yung mga gulay natin, prutas, and syempre, kailangan natin ang sapat na tubig. Nakakalimutan natin, ito ay isa sa pinaka-importante na kailangan ng katawan natin, tubig.
Okay, and with that, thank you very much, gastroenterologist Dr. Dennis Ngo and registered nutritionist dietitian Ms. Emelita Ong Lavilla for guiding us today on the topic of gluten. We hope our conversation was very helpful for our viewers. I'm Dr. Freddy Gomez. We'll see you again next time. Stay safe, everyone.